Good day everyone, I am Erica Mapolinario from BSN3G, and for today's video, I will be demonstrate the procedure providing tracheostomy care. For the goal, the patient exhibit a tracheostomy tube and site free from drainage, secretions, and skin irritation or breakdown. For the equipment, check for bedside table, towel, tracheostomy suction supplies, sterile tracheostomy care kit. If available, be sure to collect supplies listed that are not available in kit, or 2 sterile 4x4 inch gauze pads, sterile cotton tip applicators, sterile tracheostomy dressing, sterile basin, small sterile brush, pipe cleaner or disposable inner cannula, small brush, roll of twill tape, tracheostomy ties or tracheostomy holder, scissors, pulse oximeter, stethoscope, clean gloves, mask, goggles, and face shield, hydrogen peroxide, and lastly, plain NSS or sterile water. Implementation: bring necessary equipment to the bedside stand or over bed table. Perform hand hygiene and put on PPE if indicated. Identify the patient, close curtain around bed, and close the door to the room if possible. Determine the need for tracheostomy care. Explain what you are going to do and the reason to the patient, even if the patient does not appear to be alert. Adjust bed to comfortable working position, usually elbow high of the caregiver. Lower side rail closest to you. If the patient is conscious, place him or her in the semi-Fowler's position. If patient is unconscious, place him or her in the lateral position facing you. Move the overbed table close to your work area and raise to waist high. Check for lung sounds. Place the towel below the trachea site, covering the neck and chest of the client. Put on face shield or goggles and mask. Suction tracheostomy if necessary. If tracheostomy has just been suctioned, remove soiled site dressing and discard before removal of gloves used to perform suctioning. Prepare the basins and cleaning solutions. Mix sterile water or plain NSS and H2O2 in one basin. Be sure it will fill 0.5 inch of the basin. Add another plain NSS in another basin that will fill at least half inch. Perform gloving. For cleaning the tracheostomy, remove the oxygen source if one is present. Stabilize the outer cannula and face plate of the tracheostomy with your non-dominant hand. Grasp the locking mechanism of the inner cannula with your dominant hand. Press the tabs and release lock. Gently remove inner cannula and place in first basin with plain NSS plus H2O2. Let it submerge there for a few minutes. Simultaneously, gently slide the trachea pad, dressing downward and discard. Check for some exudates or drainage, skin breakdown, irritation, and inflammation. Clean the inner cannula of the trachea tube using the prepared plain NSS plus H2O2 and use brush to remove solidified or sticky mucus. Rinse using the second basin with plain NSS only. Discard gloves and put on another glove if necessary. Dry the inner cannula using sterile gauze or pad. Gently reinsert it back to the tracheostomy tube. Be sure it is properly locked. Dip cotton tip applicator or gauze sponge in cup or basin with sterile saline and clean stoma under paste plate. Use each applicator or sponge only once, moving from stoma side outward. Pat skin gently with dry 4x4 gauze sponge. Slide commercially prepared tracheostomy dressing or pre-folded non-cotton filled 4x4 inch dressing under the face plate. Check the fit of the tracheostomy collar. You should be able to fit one finger between the neck and the collar. Check to make sure that the patient can flex neck comfortably. Reapply oxygen source if necessary. Remove gloves, assist patient to a comfortable position. Raise the bed rail and place the bed in the lowest position. Remove additional PPE if used. Perform hand hygiene and document. Reassess patient respiratory status, including respiratory rate, effort, oxygen saturation, and lung sounds.